Boost overall charting efficiency with built-in documentation intelligence. The unique therapyBOSS clinician app is the tool clinicians use to document their patients' treatment. The app runs on practically any device and works without a Wi-Fi connection. It looks and functions the same regardless of the device it is used on. The therapyBOSS clinician app and its documentation capabilities are introduced in other videos. Here, we will explore how the built-in intelligence helps clinicians chart faster. We have selected a patient that has no documentation yet. Let's open this patient's menu to document our first visit. We will pretend that it is the patient's assessment, which is what the first visit is likely to be. This screen is where all visit notes are added. therapyBOSS knows which notes go with what types of visits and which of them are required. We will add the evaluation note to demonstrate some of its time-saving aspects. Clinical notes are laid out vertically as if they were a sheet of paper. Clinician simply scrolls down, completing different sections. Notice that pertinent diagnoses are loaded automatically from the referral. They can be adjusted if needed. Many areas of clinical notes consist of predefined options, like this home safety section, for example. It's easy to complete. If the situation calls for it, clinician can always enter additional information. It is often not necessary to open a section at all if clinician assesses the system to be okay. Marking no problems in this case satisfies documentation requirements. The range of motion and manual muscle testing is another example of the therapyBOSS clinician app's quick yet comprehensive documentation capability. Assuming there's no range of motion deficiencies, marking this checkbox would automatically select the same for every movement. If only one side was assessed to be within norm, clinician could then mark that entire side with just one click. Manual muscle testing features the same ability to quickly document it. Appropriate measurement is easy to choose for one side, or for both sides instantly. Any individual movements can then have a different value selected if needed. Our team analyzes the feedback from our clients and puts a lot of thought into maximizing charting efficiency. Bed mobility in this sample evaluation is yet one more example of being able to record findings quickly. Level of assist can be set rapidly for all tasks at once. Afterwards, it's possible to override selected assist level for individual tasks. Besides clever shortcuts within the clinical notes, charting efficiency is further significantly increased by the ability to copy responses between notes. We will demonstrate this by adding visit note to this sample assessment. Since therapyBOSS is not bound by constraints of paper documentation, there is no need to cram the aspects of visit charting into the evaluation note. Charting is much cleaner and more consistent when visits treatment, teaching, and patient's response are presented separately from the assessment of the patient's systems. Progress note serves that purpose. Some aspects of evaluation note repeat in the visit note, but there is no extra effort whatsoever in completing them on assessment because therapyBOSS automatically copies those responses from the evaluation note. These and other sections of the progress note, when documenting it in follow-up visits, can also be copied from the previous visits, allowing clinicians to make changes if needed and diminishing their burden. And responses can be loaded automatically when clinicians chart interim evaluations, which they do to resume patients after hospitalization or recertify for the next episode. Selecting interim will prompt clinician to load responses from the patient's previous evaluation, even if another clinician completed it.